Um, Hello, my name is Deanna. Um, I'm in Ohio. I'm from Ohio. I am an STNA for right now, and I took this course just to transition from somewhere else in the healthcare field. So let's get started. So as you can see, I have all my tools. For a second. I'm not sure if you're able to see that. Excuse my background. I just moved, so everything is still kind of everywhere. So, um, the instrument that I have in my hand right now is a retractor. I don't know. I'm seeing a lot of like Grey's Anatomy and things like that, so I'm kind of familiar with some of these. But I honestly think the retractor is used for to open up maybe the abdominal cavity when you need to basically maybe move some tissue or move some things like that. Where on the body, the abdominal area, the cavity, the stomach, the abdominal cavity, if you want to call it that. Uh, and for what kind of surgery? I think it's used for all kinds of surgery that if you're opening up the abdominal wall or just the abdominal cavity, open up the stomach, the chest, maybe. So, yeah. This is called a needle holder. Um, I think this is used. Maybe to hold a needle in place to do some suturing if you have to suture anything, suture up a wall or the outside of someone's body after surgery. I'm a little nervous, and I'm still kind of under the weather. Uh, so I think yeah, I think this is probably used to hold maybe a needle in place, like when you're doing some suturing. It could be probably used anywhere on the body, maybe like maybe the intestines, or if you have like if you're in surgery and there's a leak or you need something to hold something in place, or while you're closing, it could be used then. For what kind of surgery? Honestly, I'm not sure. I'm just gonna take a guess. Maybe like when you're going in and you have to like maybe after they remove something, maybe like after somebody Like for instance, maybe when a woman has a baby or a C-section and things like that, like I have, maybe they use this to hold the needle in place and to help with suture and things like that. This looks like a clamp or something. I'm pretty sure it's used when you may have to like clamp some aorta or anything like that. Like if you're working on a heart, I think it'll probably used in like the cavity, the chest cavity, and probably like maybe bypass or something like that. If you have to have do a cabbage. I forgot what it's called. I think it's called a cabbage. I can't think off the top of my head, but I think it's used for that. And then this looks like they remind me of tweezers, honestly, but I know it's like a forceps. Maybe it's used on the I think it's kind of used for maybe when you were trying to maybe either move tissue or suture some things. But I think honestly maybe to yeah move tissue out the way or like yeah or to grip some tissue maybe. Um, Where on the body, again, anywhere on the body, whether it's a surgery to remove like your gallbladder or to remove your uterus or any organs of that nature, then maybe you have to deal with some tissue manipulation and have to like grasp tissue and things like that. So, yeah. And last but not least, we have actually, this is a yanker. I know that because we actually use these at work. But they're more plastic. This part is kind of open. But anyways, this probably is used for exactly what I know it is, suction. Um, it could be used if you have let's say if the doctor, the surgeon is performing a surgery and he nicks some tissue or an artery and things like that. This could be used to suction out any like blood or any fluids or things like that. This could be used in almost any surgery. Probably every surgery you're going to need some suction because it's going to be bleeding. Alright, so this is part two. Here's my flashcards. I kind of opened them already beforehand just to see what was going on. So let's pick some cards. Alright. So the first card I picked is this one right here. I'm kind of covering the back so I can't see the back. Um, what is the name of this instrument and what number blade is loaded on this handle? Okay, so I would say this is a scalpel. I'm pretty sure. What number blade is loaded on this handle? I'm not sure. Maybe 12. Let's see. What is the name of this instrument? Number three handle. What number blade is loaded on this handle? It's a 10 blade. Okay. Honestly, I was wrong, as you can see. That isn't strange, and I feel like I should have actually known that, considering I've seen this before, but that's okay anyway. Um,
This one right here. As you can see, it kind of looks like a bunch of it looks like scissors almost. What is the name of this instrument? What type of tissue is this instrument used on? I think the name of this instrument may be I don't know, honestly. Needle forceps or maybe some kind of forceps. I'm not sure. What kind of tissue? Maybe like smooth tissue or something like that. Connective tissues, things like that. Let's see if I'm right. Oh, these are called zim zimbum scissors. I'm saying that so wrong. I'm not sure how to say that. And it's used for dissecting delicate tissue. Mm. So, there weren't forceps, so I was wrong. I wanted to say scissors, but I don't know. Kind of lost myself there. And I'm kind of really tired. So, yeah. But that's not strange at all. I'm pretty sure with scissors, I think I'm pretty sure you have to be use these on delicate. But honestly, no. I'll take that back because I honestly feel like that's a bit strange because they're scissors. So I would think like it would kind of like cut the delicate tissue or be a little bit more harmful for delicate tissues. What's the name of this instrument? That's on the card. These are kind of some type of forceps. That's all I know. I'm not sure of the name. Clamp forceps or something because it look like it has a little clamp on it. Let's see. Alice forceps, simply called Alice. Oh, okay. Um, nope. Also, there's one step that I think I'm forgetting too. Let me go back to these. For this 10 blade is used for cutting and dissecting, which of course that makes sense to me. Of course I know that. This is for cutting and dissecting, of course, because they're scissors, so of course they're gonna be cut. This right here is for grasping and holding. Again, I was wrong about the name and things like that, and it doesn't really shock me the fact that these are used to hold things or grabs anything because there are forceps, and that's what forceps are normally used for. What is the name of this instrument? It's called a yanker, but I'm not sure. This right here is called a yanker, but I'm not sure like if it's a actual like if it's a metal yanker or if it's called something else. Um, Yanker suction tip is for aspiration and suction, which I already knew, so that information doesn't surprise me. And which I was kind of sort of right. So I don't know if I because I didn't say yanker suction tip. I'm not sure if that makes me right or wrong, but it's up to you guys to decide. And yeah, that's it for that. A lot of these things, like with these flashcards, they were logical. Honestly, they all kind of made sense to me, especially with the categories that they were in. So yeah. And honestly, my final thoughts are I'm excited to see where this go. I really like being able to have this kit and see all the things, all the instruments that actually comes with this kit and actually know what they do and how they operate. I'm really excited to keep this journey going and honestly to see what else is in store for me and just really honestly get into a new field and well, not even a new field because I'm already in the healthcare field, but just a new part, something that's just real new and exciting to me, and just a whole new journey in that healthcare field because I always wanted to be in the healthcare field. I just wasn't sure where my stop was in the healthcare field. So again, thank you for your time and have a wonderful